Hello, my name is Shine, and I'm going to be doing the tracheostomy cleaning video. So this is my trach right here, and this is just going to be considered like my oxygenation device. That's just what worked with the angle, so we're just going to imagine. So obviously we're going to first verify our order and gather our equipment. My equipment is obviously my patient. The oxygen, we're gonna act like this is our fluids to use within the demonstration. In our trach tray, we'd have gloves, the mask, and a gown. I don't have my face mask with me at the moment. I don't have any gloves, but I do have a gown, so I will do that part, but we're just going to imagine with the rest. So like I said, verify physician's orders and gather our equipment. We're going to go into the room and we're going to provide privacy for our patient and identify our patient, explain the procedure that we are performing, and then we're going to wash our hands and we're going to don clean gloves, our splash mask, our gown. Go ahead and do that right now. And our face mask, we would wear a splash mask to make sure no secretions or anything splash up on our face and our eyes, anything like that, or splash on our clothing. I'm not going to tie it in the back. We're just going to imagine. All right. So I'm going to, with my clean gloves on, we're going to take our oxygen off and we're just going to remove this dirty dressing with our clean gloves. And we're going to dispose of that. And then we're going to set up our equipment on the table and we're just going to hyperoxygenate our client, or pre-oxygenate our client for at least 30 seconds by asking them to take 5 to 6 deep breaths and use manual resuscitation bag, or this is our device, but on 100% O2. And once that's done, we'll just kind of move that out of the way once they're pre-oxygenated and remove our clean gloves and perform hand hygiene. So we have our equipment. Now we're going to prepare it. I know this isn't a very big space, but we're going to work with it. We're going to open. I know within demonstration, we were shown that, you know, the paper says one thing and the teacher says the other. I like the teacher's idea where Miss Smith put her sterile gloves on and then opened the kit. So we're going to act like these were outside of the kit first. I like that way better than what the paper says as well. That's what I would personally do in a real life situation. I wouldn't even use the sterile gloves that are in the kit anyway. I would get my own size. So that's what we're going to do. We are going to, and this would be like a bedside table separate from the patient, obviously. And the patient would probably be in like semi-Fowlers. So we have, like I said, removed those clean gloves that we took that dressing off with, and we've performed hand hygiene. So I am going to put these sterile gloves on. Remember these outer edges. I'm trying to stick. Sorry, this side's just being a little difficult. We're gonna act like that went the way it was supposed to. And we're gonna start. Okay. Sorry, these might have been sitting in here for a minute. They're kind of sticking. Thumb out. All right, we're gonna get that out of here. All right, so then we're going to, like I said, don our sterile gloves, and then we're gonna open our kit. Okay. All right, we're gonna act like, technically, if I would have touched that corner, that would have been breaking sterility, and I'm just trying to get it in an area where you can see me. So we're gonna act like I didn't touch all over this box. So in reality, this would be closed, and I would just have that open. Or actually, would you have it open already because technically this outer part would not be sterile because it's been sitting somewhere. I'll clarify that with Miss Smith, but for demonstration purposes, we're going to say it was already opened. All right, we've got our workspace here. Shiny side down. Okay. And like Miss Smith said, it's very, technically if we dump all our supplies down, that'd be putting something non-sterile over our sterile field. But also trying to pick up everything all specifically, you can also break sterility. So for demonstration purposes, we're just gonna pour it in. Okay, so we're gonna separate our supplies here. We've got our regular gauze. I added some gauze in here because we want dry and wet gauze, so I just added some gauze in here for demonstration purposes. Then we've got our clean dressing to put back on there, our little scrubby brush, and our Q-tips. All right, so we're gonna take the ones that we're gonna make wet and we're gonna put them in the box. I need you to be able to see the box. So technically we didn't put this on the sterile field in reality, but for demonstration purposes, to fit it all on the screen and to I'm kind of using my iPad and it's not very stable, so I don't wanna move it and knock it over. So for demonstration purposes, this isn't really on the sterile field, but I just need you to be able to see me. All right, so then we're going to pour the hydrogen peroxide into one compartment and sterile water into the other. Actually with my non-dominant hand, excuse me, once again I broke sterility in reality, but with my non-dominant hand I would put the peroxide and the sterile water in one side and his hand would no longer be sterile. Okay, so obviously make sure that you lip the solution if it's previously been opened and check the expiration date. And then we're going to release the inner cannula with the non-dominant hand that's no longer sterile. This one's a little extra long here. And we're gonna put it in the hydrogen peroxide. Okay, this is still our sterile hand. And we're gonna kinda clean it around in there, make the solution kind of go in the cannula. All right, and then we would take the scrubby and we would go inside and scrub in there. And same thing over here. All right. And that would be garbage. And then we rinse. Okay. And then we dry it. I actually, in my kit, do not have the, what do you call them? The little straws that you would use to dry. So we're just gonna simulate like this is the little pipe straws. That's what I'm thinking of. And we're going to dry the inside. All right. Pipe cleaner, yeah, okay. So then we're going to replace this back in with our non-dominant hand, okay? And then we're gonna use sterile Q-tips and we would clean around if there's any crud. All right, and again, clean around if there's any crud around the little plastic part. And then we dry it, okay? And then we dry it with some dry pads. And then we would replace this dressing. Okay. And then if the Velcros were visibly soiled, you would change them. You would change them one at a time and be sure to remove the, do not remove the old straps until the new ones are applied because you don't want to dislodge this and want to make sure it's secured. Mine are having to be tied in here, so for demonstration purposes, they're clean. So then you would remove your gloves, wash your hands, document the procedure and observations, including like any trach secretions and patient response, and document.